Hi, I'm Dr. Julie Steinauer. Let's talk about a tricky condition called Duane syndrome. Now, Duane syndrome is a condition that is congenital, which means you have it from birth, and it affects the sixth cranial nerve called the Duanes nerve. It might be damaged or it could even be missing. In Duane syndrome, there are three types, and then each of those types have subtypes, but we're just going to mention the three to keep things kind of simplistic. So the first type, type 1, is where the eye can't move out towards the wall. The second type is where the eye can't move in towards the nose. The third type is where it's somewhat fixed and it can't move out or in. Now, this is tricky. Again, it's a very complex condition. It's characterized typically by an eye turn either out or in, sometimes even up. And what makes it even more complex is that in 10% of these cases, they can also have amblyopia, where one eye is kind of a lazy eye and it doesn't see as well as the other eye. So there's a lot going on with Duane's. Now, how on earth do you correct it, or what do you do? Is there any hope? Well, there actually is. In some instances, surgery is a really good option if by chance there's a lot going on with the misalignment of the eyes. And surgery isn't something that we recommend on a regular basis in our clinic because functionally we just train the brain to align and use the two eyes together. But what happens is most of the patients who come to me have already tended to have surgery at some point. And if that's the case, then our job really is just to be able to train the brain as best as we can to use the two eyes together as a team, to try to gain some binocularity or two-eyed ability, maybe to get rid of a problem like convergence insufficiency where the eyes aren't able to cross in, maybe to teach things better like how to track and use the eyes as a team as best as what we can with limited capabilities. And that's our goal with vision therapy, is to provide the best possible ability to use the two eyes together with the situation that you have. Now, Duane syndrome can also be associated with other things. So it can be associated with conditions like hearing loss and even problems with the kidneys. So there can be kind of a group of conditions that are all associated with this. So if a person has it, it actually is really important to make sure that they have good health elsewise and look into other things that could be going on for them. Now, for more information about how we work with Duane's patients and help to relieve some of the symptoms that they have from Duane's, you can go to our website at visionforlifeworks.com. Now, if you have this or you know someone who does, you can direct them either to give us a call, especially if they're local, give us a call at 618-288-1489. But you can also go to our website and fill out a questionnaire, which will come over to us, and then we can start responding with you back and forth and find out how it might be best that we could work with you and help alleviate some of the symptoms that you have for this. You have to know there's no total fix or no complete cure of Duane syndrome. If the nerve is missing, it cannot be regenerated. If it's damaged, it cannot be repaired. But what we can do again is train someone how to use their eyes and the brain and the eyes together more effectively as a team to alleviate as many symptoms as is possible. Thank you.